The full-scale crisis now gripping Britain's ambulance service can tonight be laid bare. Shocking new data obtained exclusively by GB News reveals patients waiting 4 days for an ambulance when they dial 999. One patient in England suffering from psychiatric problems waited more than 103 hours, that's 4 days, 7 hours and 54 minutes, for help to arrive. Last night, a whistleblower who works in the trust told us it's never been as bad as this. Rising numbers of people are now giving up on local services and dialing 999. It's leaving us overwhelmed and unable to get the real life-threatening emergencies in time. I've no doubt lives are at risk each and every day. Elsewhere, our investigation uncovered a case of a 5-hour wait for a patient who had had a stroke, a 2.5-hour wait for someone suffering a cardiac arrest, and an unconscious patient who waited 22 hours for their ambulance and then regained consciousness before help was able to arrive. So will Labour be able to fix Britain's broken emergency services, and who is to blame in all of this right now? To debate this, I'm joined by former Labour MP Ivor Kaplan and Tory MP Andrew Rosindell. Chaps, thank you very much. Great to have you on the show. Ivor, look, are Labour going to be able to do anything about this? What is their plan, do you know?
Well, I think what we need to do is we need to have a proper look at what the Tories have been doing in this last 14 years with the health service, because I can kind of remember, Patrick, that someone said that there were going to be 40 new hospitals in 2019 as part of the general election that year. That was a man called Boris Johnson. Now, this hasn't happened. What they've been doing is they've been adding to various projects and then calling them part of that 40. And all the time that you start that process in hospital, in the NHS, what you land up getting is an inferior product.
So more money for the NHS is what you think would fix this, Ivor?
There needs to be more and proper money dealt with properly, of course. And also, just to go on the
how much more?
Stuff,
just out of interest, how much more money, Ivor?
Unfortunately, I don't hold those.
Bottomless pit.
I don't know those numbers tonight, Patrick. And you know, I've said this to you before. We're not going to get those sort of numbers till we get closer to a general election, and everyone knows that. But the one thing I wanted to say about the ambulance service, if I can briefly, I think the ambulance service do a great job, and just sometimes it goes wrong. And what I would like to know is this wrong now? Is it wrong a year ago? Is it wrong 2 years ago? Again, can we find these details out?
All right, OK. Andrew, look, what I want to know is this. Why have we got people like NHS fat cats pocketing up to £300,000 a year? They don't ever seem to be hauled before a inquiry to answer for this kind of stuff. It is always people like you or your government, isn't it?
Look, the National Health Service is a state-run monopoly, and whatever you do with it, however much money you spend on it, and by the way, Ivor should know this, the government have actually spent an extra 45% on the National Health Service since 2018. We're spending more on the NHS today than ever before. But there are still problems with it because it is a monopoly, because it's a centralised bureaucracy, because the management isn't working as it should. There is a lot wrong with the health service, but the British people want a National Health Service, and rightly so. There should be a health service that is there for everyone. But at the moment, we're seeing failures, and we've heard about the ambulance service. I don't think, as a constituency MP, that happened in my constituency, I would be absolutely furious. The public pay for a service that they're not getting, and it does need reform, it does need change. So what I would like to suggest is that we have fresh thinking about the future of the NHS, rather than it being a political football between Labour and Conservative, who's going to spend more money. That isn't the only answer. We need a new way of managing health services across this country.
Yeah, and Ivor, why should the public have any faith that more money is going to sort this out? I mean, we've got the NHS looking to spend hundreds of millions of pounds making it the first net zero health service in the world, for example. Meanwhile, we've got people waiting 4 days for a flipping ambulance.
Well, first thing to say, and Andrew is right about those figures that he's just used, but of course, COVID made a huge difference in the budget used by the NHS in 2020 and 2021. And we won't be repeating that, one would have to say, in the next 4 or 5 years. But if Labour wins the general election, whenever that election is called, then what we will have to do is to have a proper look at the whole of the health service. To some extent, Andrew Rosindell, amazingly, is right here that what Labour should do is have a look at the whole system and then make decisions about funding, etc., etc. And I think that's what we will do, because we're going to have to do that because of the situation that the government finds itself in terms of the financial position that the economy is in.
14 years, Andrew. 14 years in charge of the NHS, someone waiting 4 days for an ambulance, and there are quite a few other cases of this as well. It is a difficult thing for the Tories to get around.
Look, I'm not going to defend the problems that the NHS is facing. And any government would have the same issues. Certainly because of the pandemic, the health services, indeed the whole country, was thrown off course, and we need to get everything back on track. But the problem is, we don't have the money that we would all like, so we borrowed $400 billion to pay for the lockdowns and the pandemic. A lot of money, and we're in huge debt, the biggest debt we've ever been in our history. So it's no longer the case, as Labour tried to always claim, that it's about spending more money. What it's about is about running a service more efficiently. And we've got a duty to look at this afresh, look at better ways of running health services across the country, and not be ideological about it. And the problem is with the Labour Party, they don't like anything unless it's state-controlled and it's all publicly funded. We have to be broader than that. We have to look at other countries and see how they manage their health services, which are not state monopolies like our one. Well, we can do
Andrew,
better, and I believe the Conservatives need to look at this afresh.
Andrew, for goodness sake, that's a sort of a speech from 1978 or 1979. That's not a speech of 2024 and what might be happening in the economy that we're going to inherit if we are lucky enough to win a general election, when you and your colleagues are brave enough to go to the public of the United Kingdom and ask them if they want a general election, which you know they
please
do.
Tell GB News viewers this evening, where is this extra money coming from that we haven't got? If Labour's coming in spending so much more on the health service, where are you finding it from? Because if we haven't got it, where are you going to?
I haven't said anything about that.
You don't seem to have an answer to any of it.
Andrew, what I've said quite consistently on GB News is that there will be nothing about actual finances until Labour can get to see the situation.
So we're going to wait until you're in power before we know what you're going to do, is that right?
This is something that happens in every general election, and you have to wait until you can see all the books and see that, and then take decisions around the whole of what you inherit as a government.
Okay, so I mean, fine. I mean, that does mean it doesn't sound like we're going to get any actual spending plans from Labour until they are in government. Some people say that's fair enough. Other people would say it would be nice. It would be nice to know. But all right, okay. Look, both of you, thank you. All right, look, we are going to have to park it there. I'm sorry, I'm not trying to cut you off. We're going to have to go. Right, former Labour Minister Ivor Kaplan there, and Tory MP Andrew Rosindell. Look, thank you very much. Now, commenting on the 4-day wait case, the spokesperson for South Western Ambulance Service NHS Foundation Trust, that's a mouthful, said, "We are sorry that we were unable to provide a timely response to some patients during this period. Our response times from the middle of January 2023 onward have recovered to a more stable position." A Department of Health and Social Care spokesperson said, "We are committed to ensuring people get the emergency care they need. Under the Urgent Care Recovery Plan, we provided £200 million to expand ambulance capacity and improve response times. We've already seen significant improvements in response times, with average Category 2 responses in February over 28% faster than the same point the previous year."